providers seeking to intervene and respond to survivors. That was the problem. The lockdown slogan, "Stay home, stay safe," was a reassuring one for the most people. But for many others, especially for women, it was a time of enforced brutal confinement with their tormentors. The ongoing coronavirus diseases, the 2019 pandemic, has been a social unequalizer besides being a global health threat. According to data by the National Commission for Women, that's called NCW, domestic violence against women had increased. These are not I'm saying. It's a data issued by National Commission for Women. That the domestic violence against women had increased manifold during the lockdown. Only between March 25 and May 31, 2020, the National Commission for Women received 1,477 complaints of domestic violence from them. This is data of the between the March 25 and May 31, 2020. The NCW received 1,477 on the record complaints of domestic violence from women. This short span of 68 days recorded more complaints than those received between March and May in the previous 10 years. That is the impact of COVID-19 on the women. The domestic violence was increased. In the entire year of 2020, when some level of restriction or movement was imposed in various parts of the country, even after the lockdown, the Women's Commission received 5,297 complaints of domestic violence. This was almost 79% jump from 2019, when the National Commission of Women received 2,960 complaints. A large number of these were homegrown in nature, related to bigamy, polygamy, dowry-related issues, substance abuse, marital disharmony, etc., etc. It is also important to understand that not all forms of domestic abuse are physical violence. The restriction of rights, mobility, autonomy, and sexual harassment are also equally traumatic. Mental and money-related maltreatment may be ongoing and subtle, but eventually normalized, although having a more prominent effect over the long haul. Furthermore, controlling behaviors, gender-based stereotypes, gender discrimination, misogynistic attitude, and jealousy can increase during a disaster crisis that reinforces domestic violence. Urgent steps of spreading awareness, mass sensitization, community-based approaches, and active inclusion of women and child safety measures during this crisis are needed to fight this social weakness. Ultimately, we can see it's almost a half population of this country. We cannot ignore that. Although the Prevention of Domestic Violence Act exists in India, I know very well about it, and very few are aware of the legal provisions available, and hence underreporting is the norm rather than the exception. I would like to, my dear viewers, I would like to share some factors and this loop of domestic abuse, especially during pandemics. First one is the lack of awareness on the availability of hotlines. Most of the individuals who undergo violence cannot report it or notify the authorities due to the absence of knowledge about the hotlines. An increase in awareness and promotion will increase the help-seeking behavior and reporting among them. The penetration of these helplines in rural areas is a challenge, definitely, as we have discussed previously. Another problem is the misinformation, the role of social media. For all pragmatic reasons, COVID-19 has turned into a digital infodemic. With data overload adding to the stress burden. Various gossips, mongering, and false news over social media appear as hindrances in the method of self-sufficiency for women. particularly for women. Increasing fear of infection and transmission also. Misunderstanding the precaution of a pandemic might alter social perception, leading to faulty attitudes among partners. Another problem is that many cases that are now enlisted at various social centers or hospitals or health centers might be lost to follow-up and reviewing during COVID-19 due to the non-availability of many health services and travel limitations. These cut off the vulnerable from social care and can perpetuate the already existing violence. Another just challenging issue is that in this current condition, it has been hard for them to connect with the healthcare professionals who provide sexual and reproductive health services face to face, and simultaneously an equivalent has not been provided currently over helpline services either, making it difficult for them, thereby increasing the rate of unprotected sex, forced sex, pregnancy, and marital rape also. The absence of thought on healthy sexuality and intimacy practices is prevalent during this pandemic, which often leads to sexual frustration and coercive and risky sexual interactions. There is a very famous work of Banerjee and Rao, in their detailed review of sexual well-being and intimacy during pandemics highlight the possible rise of coercive and non-consensual sexual practices, sexual deviation, and peace marital disharmony during the ongoing crisis, all of which can contribute to gender-based stress violence. That's called the minority stress as one of the factors promoting discrimination, stigma, and stereotype among women as passive recipients of sufferings. Passive recipients of suffering. In most of the cases, they are not active. Passive recipients of suffering, with reduced social support, disclosure, and help seeking, thereby perpetuating the cycle of trauma and abuse. Another problem is that most women stay away or avoid reporting to the police out of fear, resistance, or the dread of exploitation by the police. They tend not to have gotten ahead and come and seek help, thereby increasing the difficulty. It cannot be generalized as the same number are eager to help. Be that as it may, some awful encounters as a rule, pollute the bigger situation. The social and self-stigma related to disclosure and normalization by the families further lead to underreporting. That's another problem, another issue, underreporting issue. With numerous individuals living under the same roof, women in general deal with the task of the family as well as of the part of the child care because of the conventional structure, role strain, and role allocation that may not adequately manage, thereby causing difficulty in the form of hostility and concern. Objectification is another issue. Objectification theory states that the women are treated as an object to be valued for its use by others, and she is viewed as a physical object of a male want. This behavior in the Indian tradition is found as a normalized heteronormative tradition, thereby increasing the concerns of name-calling, self-objectification, several risks and stressors, thereby affecting the physical and mental health of women. Motion pictures and media often add to this, worsening this conviction framework. Alcohol as a mood enhancer has a direct correlation with feelings of anger, frustration, and irritation. A man's impression of the need to consent to the gender norms could be exacerbated by substance abuse, thereby shifting the focus on women. This then results in violence. Due to the vulnerabilities of women, the endless loop might continue from the women of offsprings and further forth from the family of origin, the expected normalcy from the family of procreation and difficulty in the accessibility and availability of the legal aid services, particularly legal aid services. We have the student of law which focus on legal aid also. So, and availability of the legal aid services add to the problem. It's a meager availability or the difficulty in the accessibility of the legal aid services, another issue. add to the problem. And women who are unable to go to work during the crisis have to critically balance work from home, and perception of it's a issue as now it's a debatable work from home or work for home. And now the women have to decide, or the society and the state also, which phrase they want to adopt, work from home and either work from home or work for home. I'm not saying that they should not do the work for home, but there should be a balance. And there should not be a discrimination. As a student of law, we should not support the discrimination on the basis of sex. Anyway, perception of the family might interfere with their work pattern with added domestic responsibility, the clash of which leads to discord. Many might be in financial crisis, worsening their autonomy in their respective familial circles. Another issue that's also as the knowledge attitudes or the practice gap. This is perhaps the most important contributing factor. For decades, domestic violence has been normalized by social strata across all classes. Somehow the people say it's a patriarchal society. So much so that the awareness and need for prevention are undermined costly. The effect of mental and the physical well-being is also largely misinterpreted. My dear viewers, in this beautiful country that we are living in India, okay, no problem we have, but some issues have to be discussed, have to be addressed, particularly women's issue. This COVID-19 pandemic and the lockdown has created unprecedented challenge for their, particularly for rural household, women and the most marginalized groups and women's empowerment collectives. While a slew of measures have been announced as part of the National Relief Package, women and the most vulnerable, such as daily wage workers, are facing obstacles in claiming these entitlements, either because of lack of proof of identification, such as ration card, or lack of ownership of bank accounts, and through which cash transfer have been routed. Government, either state government or the central government, they are doing their work, their best. But remember, we are living in such a country where the 100 crore plus population. So it's very challenging for the government also. And food insecurity is emerging as the most critical challenge, with evidence of reduction in the amount and frequency of food intake and lack of dietary diversity. Limited access to water and sanitation poses a challenge to tackling the virus, and instances of neglect of gender-specific health needs are also being reported. Though women's leadership demonstrated in these times of crisis offer valuable lessons on their capacities for resilience. Women's voices need to be formally included in local decision-making bodies for crisis management, and women's work needs to be recognized and compensated adequately with necessary precautions taken to ensure their occupational safety and health. For example, in China, the hashtag anti-domestic violence during epidemic in China. What the hashtag is? Anti-domestic violence during epidemic has taken off as a part of advocacy with links to online resources, helping to break the silence and expose violence as a risk during lockdown. Online and mobile services providers are taking steps to deliver support, such as free calls to helplines in Antigua and Barbuda also. In Spain, an instant messaging services with a geolocation function offers an online chat room that provides immediate psychological support to survivors of violence. For example, in Argentina, pharmacies have been declared safe spaces for victims of abuse to report. Similarly, in France, grocery stores are housing pop-up services, and rooms nights have been made available to women needing shelter from abusive situation in the pandemic. In Colombia, particularly for the women, 20,000 hotel room nights have been made available. In Colombia, the government has guaranteed continued access to virtual gender-based violence services, including legal advice, psychological or psychological advice, police and justice services, including hearing, etc. It doesn't mean that India is doing nothing. India is doing its best. The country is either on the central level or the state level their best, but there are some constraints either on the part of the economy or in the part of the just health and care. Particularly in India, violation of women's rights can be effectively curbed by adopting some essential measures like this, increasing awareness. Information, education, communication materials can be prepared to ensure the understanding of the people on IP and the help-seeking behavior through the helplines. Socio-culturally appropriate and multilingual infographics can be simple ads to put out the message to the masses. Digital literacy needs to involve women of various socio-economic and ethnic groups for greater community outreach and education. And both early identification and reporting of abuse should be encouraged among all individuals. Although crisis management and first aid are structured as a package by the mental health care professional, the aspect of networking, collaborating, and ensuring capacity building among them could be done through the training of the police personnel and other individuals who volunteer and are ready to provide protective services. Another submission of the session is that statistics once generated could be shared with the police authorities also, women's cells and the legal aid cells when the immediate release could be planned, and also in case of urgency, around the clock, legal aid courts, ambulance services could be set up, particularly for the women. And local, state, and national government could be provided with sensitive and comprehensive messages in the form of the audio, video, and the written method, such as that the maximum message can be circulated and processed for the beneficiary. Means the social media can be just used for that. And study session can be immensely helpful for a wider outreach with the integration of all levels of healthcare. Involving all levels of stakeholders in various social campaigns that incorporate awareness about domestic violence, the helplines involved and the legal provisions can be helpful. The MHE, this is the Department of the National Institute of Mental Health and Neurosciences, has already been doing novel work in the field of COVID-19 awareness using social media campaigns. Social media is uniquely equipped to support this cause due to its high penetration and consumption. In certain countries, such as France and Spain, pharmacies are being involved through media awareness. We are asking for Mask 19 is a code for domestic violence alert. Mask 19 is a code for domestic violence alert. So the women has just sent a message. That's the text is the Mask 19. It has to be an alert for the authorities. That means there is a domestic violence. So another mission, the mental health promotion needs to be integrated into health communication at all levels of care. The grassroots community workers, general physicians, and the nurses face the number of the nurses are generally female. Most of the nurses are female, and they face the maximum caseload and thus need to be trained to deliver awareness about domestic violence. And telemedicine facilities are probably an asset in these situations for digital training and communication. Voices and live experiences of the survivors matter and need to be included for peer support and training. Other stakeholders are the bodies, the justice system, social services, researchers, non-government organizations, administrators, etc. So every player of the society has to play their role. And mental health and the public health experts need to be collaborating actively with all forms of print and digital media to debunk misinformation. Because somehow the social media is also involved in misinformation, and help them educate the community about abuse prevention. Various forms of adjustment disorders, stress reaction, and the post-traumatic stress disorders are prevalent in abuse victims. depression, anxiety, and suicidality are frequent accompaniments. And some measures can be critical in helping them avail counseling and treatment facilities, fight the stigma, and preserving their autonomy and self-esteem. Gatekeeper training can help with suicide prevention. And at last, that we should think over United Nations report, which states that women comprise half of the world populace. But the United Nations is saying that women comprise half of the world populace, carry out nearly 2/3 of work hours, obtain 1/10 of world's proceeds. Giving women, they are giving their 2/3 of work hours, but obtain only 1/10 of world's proceeds and own less than 100% of world's property. Very, very alarming situation. And then Law Center 2, the University of Delhi is an innovation-led center of learning, has made giant strides towards delivering the high task vision. I hope in coming future, this Center 2, the University of Delhi will grow more and more in academic spheres. And in the last, I am again thankful to Professor Mahavir Singh ji, in charge Center 2, Professor Manjhaji.
Thank you, sir. Thank you. Thank you, sir. Thank you.
Professor. Dr. Amendra Kumar ji, and particularly Program Coordinator Dr. Dharma Sharma, who is jewel in this academic crown. Thank you very much, sir. Thanks to all.
Thank you, sir. Thank you, sir.
So nice.
Thank you, sir.
Welcome.
Thank you, sir. This was really very informative discourse. And now I would like to request Professor Anupam Jha, sir, the coordinator of the director of this webinar, to give a vote of thanks.
Good evening, all of you. Am I audible?
Yes, sir. Yes, sir.
Yes, sir. You are audible.
Very much. Very much.
You are properly.
Thank you. So, how has our afternoon passed till now in the evening today? We can't imagine. It was totally delightful and enlightening to hear Professor Tariq Sahab. How did we reach the concluding part of today's special lecture on the topic of when women's rights are not human rights and impact of COVID-19 on women's rights? I personally, I am so happy that I did not think that any second was so much of precious. So on behalf of Law Center 2, I would like to propose a vote of thanks to our speaker, dignitary, and organizers who played a great role in making today a memorable day. My heartfelt thanks to our guest speaker, Professor Tariq Anwar Sahab from Aligarh Muslim University, for his kindness to grace today's occasion and share his thoughts on this burning topic. Before coming specifically to thank him, I would take this opportunity also to pay my homage to all faculty and staff of Aligarh Muslim University who lost one or other family members in the times of COVID-19. We heard about the loss in Aligarh, and today is the time when I can share with Professor Tariq Sahab. Coming on to the topic, what Tariq Sahab was stating and observing and sharing his experiences, he started with the Vienna conference and he echoed his observations that women's rights are not the human rights, but they are sometimes special. And he talked about reproductive rights, violence against women, displacement of women, female feticide, etc. And he was right that these things should not be viewed with the same glass of traditional human rights. And I remember when I was teaching Law and Justice in Global World, then I shared with my students that many feminists believe that human rights, which are enshrined in the national and international instruments, are either gender biased or gender blind. And according to some of those feminists, human rights are rights of men, not of women. And they say that all the three generations of human rights are built upon the male life experiences, not women life experiences. And therefore, in that context, Professor Tariq Saab stated rightly that even the masks which were designed in the corona times were designed not for women, but for men. So, the feminists are right, but at the same time, non-feminists, they do not take women's lives and daily experiences into account while drafting the laws at domestic level and at international level. And therefore, it is really a challenge to walk the talk on elimination of gender-based bias, that is, against the nature, and which is the root cause of all the present evils and ills. Today, I will take this opportunity also to highlight that when the United Nations was created, the first decisive step on gender equality was taken by one of the females from India, and whose name was Hansa Mehta ji. He had showed to the whole Western women world when she was attending the meeting of UN Subcommission on the Status of Women. She said that when you are drafting the Universal Declaration on Human Rights, where the wordings were, all men are born free and equal. She said, why are you using men? Are you not going to include women? And because of her, it was now changed that all human beings are born free and equal. So you could see that how a woman could have influenced the whole drafting of international instruments at that time. So the participation of women in the drafting process, in the leadership processes, that is very important, because they would include their own experiences into the law. And therefore, the gender neutrality pioneered by Hansa Mehta holds the key for global mainstreaming of gender equality. And apart from that, UTHR, you could see that in some of the women-specific human rights instruments like CEDAW, Convention on the Elimination of Discrimination Against Women, there are, according to the critiques of CEDAW, there are very few provisions on women's reproductive and sexual rights. Sexual rights include freedom to choose partner, freedom to have consensual sex, and sex which is not linked to reproduction. And reproductive rights include access to information, advice, and services for family planning, as well as the education, information, and means to decide on the number of their children and the gap between their children. Despite several efforts by the government, maternal mortality rate in India is more than 100 in 1 lakh live births. And that is the figure at the India level. But in the states of Uttar Pradesh, Assam, and Bihar, it is around 200. So maternal mortality rate, if you look at the figure, you could see that how is the reproductive right, the scenario of reproductive right in our country. Professor Tariq Saab rightly highlighted the specific impact of COVID-19 on education of women. He said that gender gap in access to education must be filled up. And he also said that shutting down of schools in many places have harmed the abilities of girls and women. And that the burden of household responsibility increased during the pandemic. And also he said that economic hardship had put the girls at risk. And therefore, he said that we have to make a balance between work from home and work for home, and also work from home. I like these three phrases. So he was highlighting that how this COVID-19 has affected particularly the women's rights, which are specific to women. He said that 70% of healthcare workers are women and girls who were battling COVID-19 at the forefront. So it was very important when we could hear Professor Tariq saying that the challenge of COVID-19 was felt at different levels and in different regions in our country also. And that mental health was also a very important problem faced by the women of our country. And also he said that the informal sector where women are employed at the highest level, informal sector was affected in pandemic, and therefore the means of livelihood of women, and also that the gender digital divide, these all increased. So whenever the drafters of the next round of legislation, they should meet or they should respond to the implementation of the current laws, they should perhaps they should try to understand that how pandemic has affected the women's rights. Professor Tariq was also talking about the domestic violence, which is also called by international community as domestic abuse or intimate partner violence. WHO has accepted these three words in parallel. So domestic violence can also be called as domestic abuse or intimate partner violence, which is a pattern of behavior in any relationship that is used to gain or maintain power and control over an intimate partner. Professor Tariq cited the recent report of WHO showing that 1 in 3 women above 15 years of age experiencing physical or sexual or both abuse at least once in their lifetime from a male intimate partner or others. Now, this is very shocking that out of 3 women, 1 woman experience this kind of abuse. A closer study of the reality of violence shows that gender inequality remains at the root of pervasive violence against women and girls. COVID-19 forced women to remain at home, and as a result, the domestic violence increased in India, which is also the report data highlighted by Professor Tariq according to NCW. So what we have seen that today, that COVID-19 has worsened the plight of women as it exacerbated sexual and gender-based violence resulting from deep-rooted patriarchal systems, stereotyped gender-based norms, and harmful cultural practices. It is estimated by the United Nations Women that more than $1 trillion, that is the cost of violence against women and the atrocities caused upon women. It is likely to have reached frightening proportions with no let-up during the last 2 years of pandemic. Quite rightly summarized by Professor Tariq Sahab, that recovery from COVID-19 must create more equitable society. I thank you, Professor Tariq Sahab, that you have tried to share and highlight the woes and problems of women's human rights, the specific women's rights of women today. At last, I would say that we would be very happy to host Tariq Sahab in our center in person. Thank you once again for sharing your thought with us. It is high time that the Women's Week is translated into measurable concrete action at the national level, regional level, and local levels before it is too late. It is high time that the patriarchal mindset should not take over during the pandemic or such kind of bad times. Now comes the vote of thanks for our beloved Professor in charge, Law Center 2, Professor Mahavir Singh sir, who has guided the coordinators of today's event and made today's event a memorable one. I must congratulate him for successfully letting us organize this event. He has taken a lot of pains to improve the administration and the overall academic strength by frequently organizing webinars for students and faculty's benefit. During the pandemic times too, his determined efforts to ensure the equity and academic functioning in a smooth way was laudable. His style of functioning in a collective way has given him the name of Bade Dil Wale Bade Bhai. Under his guidance, various committees of Law Center 2 are functioning very smoothly. It's really a proud moment that Law Center 2 is celebrating 50 years of its establishment under his patronage and guidance.
Thank you, sir. Thank you, sir.
I must thank all members of organizing committee of today's program, namely Dr. Kalpana Sharma and Dr. Amrendra Kumar, without whose sincere efforts, today's program would have not been successful. Coordinators, these coordinators are the ones who have selected this burning topic. Thank you, Dr. Kalpana, for starting the program with personal note and brief introduction. The technical team of LC2 led by Dr. Ajay Sonavane deserves loud applause too. I extend my heartfelt thanks to all the learned faculty members, students in and outside Delhi University, faculty members in and outside Delhi University for their august presence in today's webinar. I hope that your participation will definitely take our karma of debate and discussions and better and the best academic programs in the years and days to come. Last but not the least, the Delhi University Computer Center deserves a special applaud for managing online program and giving us link to organize today's program into a successful one. Jai Hind, thank you.
Thank you, sir.
Thank you, sir.
Thank you.
थैंक यू मैडम, बहुत आपने इतनी सिंसियरिटी से आपने अमरिंदर ने बहुत ही सिंसियरिटी से काम किया, मतलब आई रियली डिलाइटेड एंड प्राउड ऑफ बोथ ऑफ यू.
It's all.
वो बड़े भाई है ना, बड़े भाई दिलवाले बड़े भाई.
Recording stop.